Let's also look at some problems with evaluation. All the same issues apply from assessment, the quantity of work rather than the quality, focusing on grading, attention to consequences, giving little feedback, and using peer reference methods. But you can add to that when you get to evaluation things like the primacy and recency effect. What are those? You may have heard of those before. Primacy effect means focusing on one thing that sticks out in your mind rather than looking at the totality of the learner's performance. And the recency effect is similar, but it's focusing on the most recent performance rather than basing the evaluation on the entire period you are going to be evaluating. Another problem is sticking to the middle. Some instructors tend to evaluate everyone as average. They stay in that middle ground. There also could be rater bias, good old-fashioned bias toward a particular group or towards a particular way of doing things. We've, here at UCR, had learners complain that some evaluators during OSCEs rate them lower because they performed a procedure the way they were taught to do it instead of the way that the rater thought they should have done it. Another issue is lack of time, and that's oftentimes the evaluator simply doesn't have enough time to provide good, solid evaluation. That could be a lack of time to observe the learner in a clinical setting, so not knowing how to evaluate them based on such limited exposure. And another and kind of darker issue is fear of exposure. Some instructors don't want to evaluate their learners fairly because they feel that this might expose them as ineffective educators. You know, we've all heard that old cliche that when a student fails, we failed them. And lastly, one of the problems with evaluation is conflating assessment and evaluation. While they are related, they are separate things. Sometimes in their desire to promote a learner's career, an evaluator forgets to take off the mentor hat and evaluates more generously than the performance indicates because they want to help the learner. Assessment and feedback can play that role of helping the learner, but when it comes to evaluating, we need to be strictly objective.